Hi, Dr. Ben White here, physical therapist, residency trained, board certified orthopedic clinical specialist here in the United States. Today I want to talk about a question I get asked a lot in the clinic, and that's about cortisone injections. Why they work for some people, why they don't work for other people, why they only work for certain periods of time for some people. And I think it's important that we ask these questions because we should know what's happening to us, what's happening for our health. For better or worse, we should know the thought process behind whatever procedure we're going to undergo. That way we can make really good, educated decisions about our next steps. So before we actually talk about the injection itself, it's important to talk about the process of tissue healing. Whenever we get an injury, in any tissue, we break a bone, we tear a tendon, we tear a muscle. It all goes through these three phases of tissue healing. So we have an inflammatory phase, lasts a couple days. Cells rush in, try to clean it up, make everything good. Proliferation phase, we start to build think about like building a scab. It's kind of loose. And then finally maturation, we actually start to develop a scar. Now with a cortisone injection, they can be a great drug. But we think about it oftentimes as being a pain relieving drug, and that's not necessarily the goal of getting a cortisone injection. Really the goal is it's a diagnostic procedure. If we inject a joint and we get pain relief, which is awesome, we have a pretty good understanding that painful joint is due to an inflammatory process going on. Now if we don't have a good result, we don't have pain relief, we can be pretty confident, at least right now, that the pain that you're experiencing isn't necessarily caused by an inflammatory process. We might want to consider something else besides a local issue. That's for another video though. So why do some people have a good result and some people have a good result for a certain period of time? So what is happening when we get the cortisone injection, it kind of knocks us out of this inflammatory phase and lets us start proliferation phase where we're actually starting to lay down new cells and create a good scab and start to heal. Now, if we kind of regress and we start getting that pain back, maybe we get another injection and it improves, we can be pretty confident that whatever's happening in that shoulder, we're still creating an inflammatory response. So if it's a movement problem, which most of the things I see that are inflammatory related are movement problems, we're causing some kind of irritation, and that irritation is driving that inflammatory process. And unless we can fix that, we're still gonna kind of be doing this little seesaw between inflammatory proliferation. The people I see that do really well with the cortisone injection are the people, maybe they have been doing a lot of their own research and doing good exercises and making their mechanics really good. They just can't get over it. And so they get an injection, they continue with their exercises, and they're able to finally start to develop a good scar and be pretty pain-free. I know from personal experience, I recently had a cortisone injection in my elbow. I've been having this pain on the outside of my elbow, kind of like a tennis elbow, and that's the way I was kind of self-treating it. Wasn't getting any better, I started doing some things to the joint, and I saw some people, and we were pretty confident that it was a joint problem, not a tendon problem. Went into the orthopedic, he injected my elbow inside the joint, instant pain relief. Now, I started doing some of the things that were causing that irritation in the first place, and my elbow pain is starting to come back, but I've got a better understanding of why. And so in my exercises, I'm trying to train around that and figure out how to use my body in a way that's not gonna drive that inflammatory process, drive I think it's an impingement that's going on inside my elbow. And that's how I like to use a cortisone injection. I don't actually do them, but when somebody has them, it's a diagnostic procedure. Is something going on in the joint that's causing an inflammatory process? Or should we start looking at another source of our pain? Not necessarily where the pain is, but something that is talking to that painful spot. Thanks so much for watching.